The Conversations on Health Equity Online video series is produced by the Health Policy Research Consortium, funded by the National Institute of Minority Health and Health Disparities. Located in Greenbelt, Maryland, under the leadership of our principal investigator, Kwesi Nfume, HPRC conducts policy research on issues related to health inequities throughout the country with a focus on the Mid-Atlantic region. HPRC uses a transdisciplinary research approach to close the gap between policy and science by assessing how current and proposed policies affect various populations. Major research efforts underway include the Health Policy Literacy Study, the Policy Portal, various research papers focusing on behavioral and social sciences, and a cardiovascular disease study focusing on disadvantage in the food, built, and social environment. For more information, visit our website or our social media channels.
I want to turn, lastly, to the future. Look inside the NIMHD crystal ball, if you will. First, take a glimpse back. In 2000, we started with the National Center for Minority Health and Health Disparities, and 10 years later, it graduated to the National Institute on Minority Health and Health Disparities. I'm wondering, where's all of this going? What's in store for NIMHD in the years ahead? And more importantly, where's health disparities going? The whole movement to close the gap in health for many populations. Where is that going to go in the years ahead as well?
So I see NIMHD really as prime position is to lead the scientific inquiry into the mechanisms of health disparities. Studying populations using race, ethnicity as a critical factor, critical variable, not only is it important socially because of our diversity in our society, not only is it important because traditionally these groups have done worse, although not always, but because it will actually allow us to ask and learn, ask scientific questions and get knowledge that otherwise wouldn't be available, whether it be in the gene discovery category or in the behaviors that actually are protective as well as lead to worse outcomes, in the way that environment affects people physiologically in terms of stress or discrimination. When we have studies that were more uniform in terms of race, ethnicity, and social class, but particularly around race, ethnicity, I think we lose opportunity to learn. And I think that's an increasingly point that scientists working in this area are discovering in their own work, as well as promoting as why this is important. This isn't just about being nice. This isn't just about social justice or, 40% of the population is minority, we better have them in our studies. This is actually a scientific opportunity to learn. And if we don't have the participants of the different groups there, then we won't have the opportunity to know what we didn't learn. And there have been a number of good examples that are cited already in the literature, and I think this has to be one of our central points. More colloquially, more locally for NIMHD, I want us to be the home of this science, the leader in this science. We're going to always be small by comparison, but we should be getting the best scientists in this area, touch them, make them grow, own them, and support them in their growth. I know the community's there. I know there are people out there who do this. And so it's our responsibility to find them, support them, get the grant mechanisms to work for them, and see them grow. Also, NIMHD, although it doesn't do, as I said, much in the training space yet, and we probably wouldn't do a whole lot unless we had a lot more budget, is support the diversity of the biomedical workforce. Right now, 5-6% of NIH principal investigators in research grants are either Latino or African American. And that is something that with the population in 2010 of those two groups being about 30%, it doesn't pass the smell test. So we need to do something about it. I think Dr. Collins hired Hannah Valentine as the Chief Diversity Officer for the agency. I think Hannah has brought together efforts on how we begin to address this. This is not going to be resolved in a short order. We need to create mechanisms where we can see the long-term view of how this can get better, because we have stood still for too long on this issue. Or the change has been way too slow for us to sit back on it. And finally, I would say that the issue of you had asked before about inclusion of participants. That's another area that I've already argued why we need the diversity. And our NIMHD needs to use and leverage its resources with the other institutes to contribute in a unique way and collaborate with other institutes. Our area of priority is on advancing knowledge and science. And our expectation is then that maybe folks like you will take that and implement it into policy and in communities. And we will be as supportive as we can be of those efforts.
And are you optimistic, and in the years ahead, we will at some point close the health gap for these communities?
I am always an optimist.
Okay.
I do believe that some inequities, disparities, may not be avoidable, to use the WHO terminology. I think some differences may be related to things that we can't modify. But we should be able to ameliorate those or anticipate them and be able to deal with them like we do with other inequities. We live in a society that by its very nature generates inequality, just the nature of the system. And there is no viable alternative system to say, well, we should do that instead of this. So our role being more global, and particularly in government, is to look out for those inequities and try to manage them. There are clearly avoidable ones, as we've talked about, that we can do research and figure out how to avoid them, how to avoid these inequities. But there are some I think we're going to always have to look for ways to decrease them. So we say reduce health disparities, not eliminate, but that's where I am with that.
Well, Dr. Pérez-Stable, it sounds like the work of NIMHD is indeed heading toward shaping the NIMHD as the leader of minority health science, and certainly the home of minority health science. Thank you so much for your time and for your insights. It's been an absolute pleasure.
It's been a pleasure to talk to you. Thank you very much, John.
You're quite welcome.
Yeah.
Thank you for joining us at Conversations on Health Equity. We hope you'll join us next time. Visit our website at www.hprc.info and learn more.